Welcome back to another Explainer, everyone. Today, we're unpacking a topic that honestly strikes fear into the hearts of so many of us, especially as we get older. We are talking about chronic kidney disease, or CKD. Now, I know it's a heavy subject, and you instantly think of daunting lifestyle changes or the looming threat of dialysis, but don't worry, because the source material we're looking at today provides a surprisingly reassuring, super practical guide to navigating this whole thing. We're going to be breaking down a fascinating conversation featuring Dr. Takefumi Mori. He's a kidney specialist who takes a remarkably unique approach to his practice.
Dr. Mori describes his clinical philosophy with this brilliant metaphor. He states plainly, "I act like a medical sommelier." Think about it. When you travel to a new region and you have no idea about the local food or wine, a good sommelier doesn't just force their favorite drink on you, right? They ask about your tastes, your preferences, and they match the menu to you. Dr. Mori argues that a doctor shouldn't just dictate fixed, rigid treatments. Instead, they need to offer a menu of options that actually fit a patient's unique life and their personal lifestyle goals. This is absolutely crucial for elderly patients who still have diverse ambitions and things they want to experience. The whole point is about maintaining your life, not just treating a failing organ.
Okay, let's dive into this because we need to start with a stark reality check. 18. This is the EGR score, which is a critical measure of kidney function of Mr. Ogura, the interviewer in our source material. To put that number into perspective, Mr. Ogura has battled diabetes for 40 years. He survived cancer, and he actually had one of his kidneys removed. So his remaining kidneys function dropping to an 18 is definitely no laughing matter. At this level, the terrifying prospect of artificial dialysis is literally knocking right at his door. He's actively having to research what kind of dialysis he's going to need to undergo, and this brings a tremendous sense of urgency to our explainer today.
Section 1. Defining chronic kidney disease.
So, before we get to the treatments, we really need to understand the mechanics of the disease itself. What exactly constitutes this condition that terrifies so many people? Well, the golden metric here is eGFR, or estimated glomerular filtration rate. Simply put, it's just a score indicating your kidney function. You're officially diagnosed with CKD when this score drops below 60, or if you have other abnormalities, like structural issues or protein in your urine, and those persist for over 3 months. Now, what's really interesting about this is that eGFR naturally declines with age. It's just a built-in part of getting older. Dr. Mori actually points out that, purely mathematically, if you look at people over the age of 80, a massive portion of them technically fall into the CKD category just from natural aging. So the key isn't just the number itself, but the angle and speed at which that number is dropping.
And when that number drops too fast and too far, that's when we face dialysis. But what's actually driving this decline? Historically, the undisputed heavyweight champion causing dialysis has been diabetes. However, the data shows a pretty fascinating shift. Because diabetes treatments have advanced so incredibly well in recent years, the number of patients going into dialysis strictly from diabetes is actually stabilizing, and in some places, even slightly decreasing. On the other hand, look at what's rapidly rising: hypertension and arteriosclerosis. Essentially, high blood pressure and hardening of the arteries. As our population ages and people are exposed to high blood pressure for way longer periods, these aging-related factors are becoming the new primary drivers forcing patients into dialysis.
Section 2. Spotting the silent threat. Knowing the causes is one thing, right? But detecting the disease in time is where the real danger lies. And this brilliantly illustrates exactly why CKD is called a silent threat. When you break it down, from an eGFR of 60 all the way down to 30, the vast majority of patients are completely asymptomatic. You feel entirely normal. You might have slightly elevated blood pressure, but absolutely nothing that screams organ failure. The suspenseful reality is that you generally don't feel anything until your function drops below 30. Once it plummets into the 20s or teens, that's when the undeniable symptoms hit: severe swelling, breathlessness, and the immediate looming risk of dialysis. By the time your body actually tells you something is wrong, you're pretty much already standing on the edge of the cliff.
Because your body won't warn you in time, you have to be proactive. So the absolute most crucial point is how you detect it early. Our sources outline 3 very simple, actionable steps. First, never skip your regular medical checkups. Your blood and urine tests catch what you can't feel. Second, pay attention in the bathroom. If your urine is consistently bubbly, that could indicate protein leaking from your kidneys, which is a major red flag. And third, actually, you don't even need a doctor's appointment to check this. You can buy simple urine test strips right at your local pharmacy to monitor for protein or blood. Catching it here gives you the precious time needed to slow the decline.
Section 3. The Diet Balancing Act.
Once you know you have CKD, how do you slow that decline down? Well, it largely comes down to what you put on your plate, which introduces the daily, honestly agonizing struggle of the CKD diet. If there's one number that haunts a kidney disease patient, it's this: 6 grams. That is the strict daily limit for salt intake. For anyone used to normal cooking or eating out, 6 grams for an entire day is brutally restrictive. Mr. Ogura mentions he's from Akita, which is a region in Japan famous for loving salty foods, making this limit feel almost impossible. It just completely upends your relationship with food.
Let's actually break down the terrifying math of that 6-gram limit. Even if you eat entirely raw, unprocessed foods with absolutely zero seasoning, those natural ingredients intrinsically contain about 3 grams of salt. That leaves you with a mere 3 grams of allowable added salt or seasoning for your entire day's meals. 3 grams. That is roughly 1/3 of a standard plastic bottle cap. Imagine trying to flavor your breakfast, lunch, and dinner with just that tiny pinch of salt. It's a monumental, everyday challenge.
Mr. Ogura shares some incredibly relatable anecdotes about this daily battle. He talks about literally standing in the supermarket, meticulously scanning the back of frozen foods. He sees this delicious-looking meal, realizes it has 4.1 grams of salt, and regretfully has to put it back, settling for a blander option with 2.2 grams just to survive. He describes scouring the internet to hunt down rare zero-salt curry just to feel a fleeting sense of normalcy. And perhaps the most difficult part is the guilt. Because his diet is so strict, he feels awful forcing his family to eat his flavorless food, which usually results in the family having to cook entirely separate meals just for him.
But here's where we hit a massive, super dangerous paradox in CKD treatment. In the desperate attempt to save their kidneys, patients often restrict not just salt, but potassium from raw vegetables, phosphorus from dairy, and protein. If you do this too strictly, especially as an elderly patient, you just stop eating enough entirely. This leads to sarcopenia. Sarcopenia is a significant loss of muscle mass and strength directly caused by the malnutrition of an overly strict diet. You are essentially starving your body of vital nutrition just to protect the kidneys.
And sarcopenia acts as a gateway to an even worse condition, frailty. This is a state of severe physical weakness and reduced mobility that directly follows that muscle loss. Dr. Mori issues a stark warning here. If a patient overdiets, loses all their muscle, and falls into a state of frailty, it actually makes the eventual dialysis treatment incredibly hard to endure. If you start dialysis when you're already frail and malnourished, you are going to struggle immensely to ever recover your strength. This beautifully illustrates that managing CKD isn't just about cutting things out. It's a delicate, absolutely critical balancing act between protecting the organ and nourishing the whole body.
Section 4. Life beyond kidney failure.
Now, let's step back from the anxiety of diets and declining numbers for a second and look forward to offer a much more reassuring perspective on the later stages of this disease. It forces us to confront a terrifying question. Does end-stage renal failure mean it's all over? It's a heavy, intimidating medical term. When you hear end-stage, it sounds like a death sentence, doesn't it? It sounds like your lifestyle, your ambitions, and your freedom are just completely finished. But is that the actual reality?
The answer, wonderfully, is no. And this brings us right back full circle to Dr. Mori's philosophy of the medical sommelier. Treatment is not just one fixed choice, it's a flexible series designed to maintain your life. Starting dialysis or entering the later stages of kidney failure isn't the end of your story. Modern treatments are adaptable tools. A good doctor is going to work with you to swap and combine these tools to preserve your specific, unique lifestyle for as long as possible. So what you should take away from this explainer is that while CKD requires serious vigilance and dietary discipline, it's a manageable journey, not a cliff edge. Which leaves us with this final thought. If medical treatments are becoming a customized menu rather than a rigid prescription, how might we rethink our approach to other chronic illnesses in the future? Keep learning, stay focused, and we'll catch you in the next explainer.